we want simple. What are the symptoms? How do I protect myself? And how do I kill it? Keep it simple. So that was the main idea of the class. Obviously, we're going to talk a little about safety that you can take, and just a little background knowledge, which will help as we go through the different infectious diseases. So we're going to talk about a number of different cleaning products. There's in no way am I endorsing any one product. There are many examples of them. These are the ones that I see most frequently in our ambulances around Bergen County. Obviously, you want to use hospital-grade disinfectant whenever you're cleaning EMS equipment. So we're going to talk about these diseases. We're going to review transmission and physiology. We're going to talk about levels of PPE. We're going to discuss specific diseases. So, in general, there are lots of resources out there. The CDC is updating hourly, so is the World Health Organization, and in general, the EMS Infectious Disease Playbook is a great resource for what we should be doing as far as decon and PPE. So this class is current as of today. We're learning things every single day about these different viruses, etc. You need to stay up to date. Just because we took a class today doesn't mean that in 6 months these buggers have not evolved and become worse. So make sure you stay up to date on information. That is our responsibility as providers to stay up to date. So let's talk some language first. Because we never have people running around with their hair on fire freaking out about things, right? That never happens. All right? So let's talk about things that are endemic. What's an example of something that's endemic? Okay, so flu, cold. Do we expect there to be flu between October and March every year? Yes, that's normal. If it's averages 10% of the population of our county, that's not an official statistic, I'm just throwing a number out there, then that is our endemic, that's our baseline. If suddenly it was 90%, that's a different beast. So an epidemic is when you suddenly have that enormous spike. So like we had here, the endemic rate, and suddenly you have this massive increase in it, that's when we consider it epidemic. And that's in a specific area. The word that we're hearing now a lot is pandemic. This is when you have epidemics spread over multiple areas. So, viruses and bacteria. What are the big differences? Nothing crazy complicated. Anybody? Okay, so the biggest thing is that antibiotics don't work on viruses. Don't go to your doctor when you have a cold or the flu and expect antibiotics or even want antibiotics. All right? Viruses are not organisms. They're literally just RNA wrapped in protein. They can't replicate without our cells. Bacteria are actual organisms. They can replicate. They can continue life processes. They can be affected by antibiotics. So what happens, short answer, the antibiotics affect the cell wall of the bacteria. Weakens it, and your immune system can get in and kill it. Unfortunately, when we deal with viruses, you just said it's a layer of protein. There's no cell wall, so the antibiotic doesn't work. Since 1990, most drug companies have blank antibiotic research. What do you guys think? Yeah, unfortunately, it has been decreased. 78% of drug companies have scaled back. It is getting harder and harder to create effective antibiotics. So we mentioned viruses. So he attaches to the cell wall, injects the RNA. It uses our own cells to replicate and create more. The cell bursts open, and the whole process begins again. So there are antivirals out there. We see them for herpes, we see them for HIV, and they work by preventing the virus from getting into your cell in most cases. Generally, blank out of 5 infectious disease drugs that reach the initial phase of testing in humans will receive approval from the FDA. This is where it's getting more and more difficult. You put all this research into these new antibiotics, but then only 1 out of 5 is actually going to get FDA approved. So, first thing for protecting ourselves is talking about transmission-based precautions. So, how many people here have ever responded to a nursing home? If you're not raising your hand, you're probably lying. All right. How many times have you seen there's a sign on the door that says, oh, you need to use whatever precautions? And how many times have you seen people just go and walk in? I've lost count. Okay? Those signs are there for our protection. The minute you see the signs, you should be asking, what is this for? What's the issue at hand? So in this case, we have contact precautions. Hand hygiene, which will appear every single time, a gown, gloves, and it will usually specify whether or not you also need goggles. Droplet precautions, hand hygiene, and a surgical mask. So there's a surgical mask and there's N95. Well, droplets too large to be airborne for long periods of time and quickly settle out of the air are droplets. So when it's airborne, it's actually small enough that it can be on dust particles, it stays in the air for far longer. That's when we have to make sure that we're using an N95. Now, there are times you will see combinations, and that's what we're dealing with coronavirus. We're seeing a combination of different precautions that we need to take in order to safely protect ourselves. So, hand sanitizer, one of our key weapons against coronavirus to keep ourselves safe. Tell me if you've ever seen this. 99% of the times I've seen people use the alcohol hand gels, that's what I've seen. That doesn't work. Okay? You're wiping it away, you're not using it correctly. You are going to keep rubbing it on your hands, and we're going to show you how to, until it's dry. Keep rubbing. You're going to rub the same way you are when you wash your hands. So when we wash our hands, it's not just a quick spritz and run out. It's supposed to be about 20 seconds or more. And as first responders, we've all been trained how to properly wash our hands. So as I was building this class over the last 2 months, every time I rode the medic truck, I watched how responders were washing their hands. Or using hand gel. Take a guess the percentage of people that were doing these things correctly. I hear 30. I hear 3%. I hear 0. Give that man a prize. The number was 0. We are our own worst enemies. People are not doing what we've been trained to do. We've gotten complacent. We're not dealing with infectious bugs all the time. We don't do what we're supposed to do. So, the next question that inevitably pops up before you can do the hand washing is, well, antibacterial versus plain soap. Oh my God, I need antibacterial soap. There is no evidence actually supporting the effectiveness of antibacterial soap for your hands. You're not trying to kill the bacteria on your hands. You're trying to get it off. So plain soap, they're finding, is just as effective as using antibacterial soap. So don't panic about that. So this is a video, if I remember correctly, it's World Health Organization, on how to properly wash your hands.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Touch the dirty door.
So how many people have been doing
Right? Then touch the dirty door.
Anybody?
Yeah, okay.
So don't forget that little part at the end. If there's any nurses in the room, when you actually take the NCLEX, they fail you if you touch the dirty faucet for your hand washing portion. You go through all that effort to wash your hands. What was the last thing to touch that faucet? Dirty hands. So you touch it again, and now what have you redone? Contaminated yourself.
But not the door. What about the door handle?
Dirty doorknobs, absolutely.
Have somebody open the door for you.
Okay, so this one drives me crazy. If anyone's ever been on a job with me where I said, oh, I need someone to drive my truck, and I'm holding the keys in my hand, I literally dangle them and tell you you don't get them until you take your gloves off. Under no circumstance should you be driving any emergency vehicle with contaminated gloves on. What are you doing? You're literally rubbing bacteria, virus, whatever, all over the steering wheel. The idea, whether it be your patrol car, whether it be the front of the ambulance, that should be clean. That should be our safe zone. Don't bring things into the cab of your vehicle. Hard no. So let's start talking about some of the bugs. Let's talk flu. What do we know about flu? That's the one we've been dealing with probably the most of all these infectious diseases. So what do we know? It changes every year. We have a shot for it. What else? It can kill. It spreads very easily. Okay, so those are the basics, all right, and you will see that a lot of those are very similar in corona. So flu is a virus, mainly by tiny droplets made when people cough, sneeze, etc. is how it gets out into the world here. About 8% of the US on average gets the flu each season. So flu is a respiratory illness. It gets down into your lungs. Your lungs get sick, your immune system attacks, you can get swelling, you can develop pneumonias, etc. You cough, you sneeze, you have fevers. There's multiple types of flu. Generally, we deal with type A, once in a while with B. Without getting super complicated, we've all heard like, oh, this is H1N1, this is H3N2, whatever the case may be. The fancy names just come from the proteins on the outside of the virus. Don't go crazy. But there's lots and lots of combinations of them. That's why we can't just be inoculated against flu. So this is, what was the word we used at the beginning? This is the endemic, this is our normal, this is our baseline, all right? On average, this is most of my life, that's what we have seen. So this is a happy month. Usually, we're at the end of flu season, okay, things start getting better. How many cases of flu illnesses in the US so far this season? Take a guess. The answer is not E. I hear D, I hear C, I hear B. The answer is C. So this is as per the CDC. So as you will see, we have had flu deaths. Now, whether there's a range there, whether it's specifically caused by flu or by other underlying medical conditions is obviously in question, but that's the ballpark of how many people have had flu deaths. So, you're home, you don't feel well. Do I have a cold? Do I have the flu? What's the big differences? So how many people here have had the flu? Okay. The day before you got sick, how'd you generally feel? Maybe a little achy at most. Okay. When you had a cold, how long did it take for you to start feeling ill? Usually a prolonged period. I feel a little stuffy. Now my throat's a little hoarse. That kind of thing. Usually, flu is much more abrupt. And flu is also accompanied by a fever, where colds usually are not. So, different Me Too movement. When we're dealing with people who we think have flu, just like we're going to do with coronavirus, they get a mask. If they're short of breath, they need high flow oxygen, you can put it on or breathe on. Otherwise, put a face mask on. Okay, this is not an N95, this is just a basic surgical mask. Get vaccinated. For years, there was issue with people with egg allergies. That's not really a concern anymore. They developed the vaccine differently now, which has also led the vaccine to being much more effective than it was a decade ago. You know, it used to be a kind of a crap shot. It's not anymore. It's far more accurate than it used to be. All right. Common complaint we hear. The flu shot gave me the flu. So, has anyone ever felt a little ill after getting the flu shot? Okay. Flu usually lasts how long? You know, usually like at least a week, right? You got the shot, you felt a little icky for like a day or two. That's not the flu. That is just your body having an immune reaction to what was put into it. It's normal, it means it worked. All right? You did not get the flu from the flu shot. So in general, what kind of precautions do we need? Surgical mask, gowns, that's how you protect yourself when you need it.
Sorry.
Okay.
She felt fun at her. Looking at her phone.
So
Yeah, of course, I was behind.
you have someone confirmed with flu. How do we clean our equipment? The purple tops, which most of us carry in our ambulances, do work on flu. Don't forget to clean the things like blood pressure cuffs and stethoscopes. You got to wipe all that stuff down. That's the stuff that gets forgotten, and then we're literally transferring it to the next patient. Also, you're wiping down your stretcher. You use the purple tops. Can you immediately just start throwing sheets down or start touching? No, you got to let it dry. The manufacturer actually specifies wait 2 minutes. If you use bleach, you're supposed to wait 4 minutes to let it dry. Give the chemicals a chance to work. Also, if the patient is particularly gooey, for lack of a better term, don't just take the purple tops and go, okay, we're good. Wipe off the goo first, clean that, and then hit it with disinfectant. Otherwise, we're literally just smearing stuff all over the stretcher. Also, one wipe doesn't do the whole stretcher, the whole ambulance, the whole front of the patrol car. It doesn't work like that. The minute it's not wet anymore, it's not doing anything. All right? So you will go through multiple wipes as you're doing this. Don't get stingy. Okay, there's also another from the same company, Sanaprime spray will also work on flu. It works a little faster, only a minute. It'll be a little easier to spray, whatever works for you. So the Department of Health had done, the State Department of Health had done a swabbing of ambulances, either last year or the year before. And they were specifically looking for flu. How do you think it went? Well, they found it. Yeah, they found it in every ambulance. We're not cleaning things the way we're supposed to. Right? Make sure that we're wiping things down after calls. You come in, whether it be you're a police officer, whether it be you're an EMT, you get your vehicle. What should we probably do to the front of the vehicle before we really get in it? When we take control of it for the day? Wipe it down. Wipe it down. Protect yourself. So, Candida auris, specifically drug-resistant Candida auris. We have had nursing homes infested with this in Bergen County. It is out there. So what is it? Well, this is a fungus. Funguses are particularly difficult to kill. It can be person to person, person to equipment, and then to a person. There are multiple strains of it, and there have been every version of it in the US. So our fear is that you get colonized with it. So I see the warning sign on the nursing home door that says contact precautions. But dun 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 dun, I'm super medic. I'm not worried about that. And I just go walking in. And this gentleman will say, has Candida. And I'm treating him, I'm doing whatever I need to do. I'm getting the fungus on me. Now, I have a very healthy immune system. I may not show any symptoms of it, but I'm colonized. It's growing on me. And you can spread it then to anyone you come in contact with. And almost everyone in this room knows someone who is a cancer patient. They have some sort of immune problem. They're currently sick. They've had surgery. You don't want this getting onto someone, especially when it's drug resistant. So where we see it the most, we see it in hospital nursing homes. As I said, we have had in Bergen County. What we need to do, hand hygiene and gloves. Contact precautions. Don't let anyone into your vehicle, meaning like a passenger getting in the front seat, without doing hand hygiene. Loved ones are probably not wearing gloves every time like they're supposed to. Have them wash their hands before they get into your room, into your vehicle. Another problem though, notice that I'm only showing you soap and water. Guess what doesn't work? Yeah, the alcohol sanitizers do not work. Colonized for months. It takes a lot to get rid of it. The more you can avoid it, the better off you are. So, what can we do? We've got multiple products that will kill it. Obviously, there are different amounts of time for different products. Anything that can kill C. diff, and this is as per the CDC, anything that's registered as being able to kill C. diff will work on Candida. So MRSA. How many people have heard of MRSA? Okay, good. So MRSA is a type of staph infection, staph. So it's a bacteria, it goes person to person, person to equipment. 1 in 50 people have it. You said there's what, 250 people in here? That number gets even higher when we talk about staff in general. 25 to 30% of the people in this room have staff probably in their nasal passages. Okay? Thankfully, it's not MRSA, but there are staff out there. We have lots and lots of bacteria in our bodies. Some of it's good, some of it's not as good. So it can survive for weeks on surfaces. That's why it's so important to clean things. Why are we concerned? Well, if you've got any sort of opening into your circulatory system, MRSA gets in there and it causes infection. So what will it look like? Redness, swelling, warmth, pain, tenderness. Right now it just looks like a general infection, right? Everyone's had an infected cut or something before. Sometimes you'll hear people say, oh, it looks like it's a spider bite. A brown recluse bite does not look like that. Brown recluse bites are much more like cavernous. It's acidic. It actually erodes at the skin. So what distinguishes it, you get this fluid-filled cavity. It's movable. It's compressible. It's got that gooey center. It comes to a head, and it drains pus. All right? So in general, we want contact precautions. If you have something that's particularly squirty, you can wear eye protection as well. So we have disinfectants that work on it. Our purple tops do work on it. You're looking for anything that kills Staphylococcus aureus. So norovirus. What do we know about norovirus? I heard it sucks. It does. It's horrible. What else? It spreads like wildfire. All right, what else? It's a rough way to lose weight, let me tell you. So it's a virus. And this one's different from everything else we're going to talk about today. It actually can contaminate food and water, which is a big part of how it spreads. It can survive days or even weeks on surfaces. That's why we hear like, oh, it happened on a cruise ship and suddenly everyone on the cruise ship has norovirus. It's particularly nasty. So it's usually a pretty sudden onset. Diarrhea, nausea, vomiting. Sounds like a typical stomach bug, right? Norovirus is worse. Norovirus, then you add the body aches, the fever. So now it's got all the fun of flu with explosive diarrhea and vomiting. So there are a lot of cases of it every year. There is question about how well we develop immunity to it. Just like with measles. How many people here have had a measles booster? I would hope everyone's had a measles booster. All right? Because your immunity doesn't necessarily last forever. They're not sure how long your immunity lasts. So if you get a norovirus, in a few years you may not be immune anymore. They're still researching that. They're not sure, and there's more than one specific type of it. So if you had it before, you can still get it again. So it usually starts pretty quick, 12 to 48 hours after exposure. And again, this is where it's worse than our normal stomach bug. Everyone in this room has probably had a stomach bug. You feel like crap for 24 hours. Try doing it for 3 days. We've had patients where they are so profoundly dehydrated. They start having cardiac symptoms, stroke symptoms, all because of the extreme level of dehydration. Right? You should not be having explosive diarrhea for 3 days. So, here's the other problem. It gets shed, the brown route, and after you feel better, you're still shedding virus. So let's say a week ago, I had norovirus, and I jump in a pool. Unless you are power washing down there, you are not going to have it where you don't let off some sort of particles. And you have now spread norovirus. We said it spreads through water, etc., food. It's also extremely resilient. Again, this is why it spreads like wildfire. It can survive freezing. Depending on how hot you get when you steam clean it, it can even survive steam cleaning. All right? And it's tolerant to most disinfectants. Nuclear apocalypse, it's going to be roaches and norovirus. All right? Got to be careful with how you approach this. So, gowns, glove, our normal contact precautions. Alcohol does not kill it. You pretty much need to use bleach. That's the thing you have most readily available to you. Bleach will kill it. Meningitis. What is it? I know most of the towns have had some scare over the years about meningitis because we get the phone calls going, oh my God, we transported a patient with a stiff neck and didn't feel well, and can you get us an update? So most of the towns have encountered meningitis. So it's inflammation of the protective membranes that cover your brain and spinal cord. So it's a process, not the infection. So the infections will give you a headache, fever, stiff neck. Those are the common symptoms. There are lots of things that can give you meningitis. The two that we worry about by far the most are bacterial and viral. Viral's the most common, bacterial's the most dangerous. So bacteria gets into the bloodstream and it can travel up to the brain and spinal cord, and that's where you start getting all of this swelling. These are the leading causes of bacterial meningitis. Which leads us to another problem. If lots of things can cause it, can I answer this question? No. That's one of the problems that we encounter when dealing with meningitis. We're not sure because as first responders, do we know what the person's diagnosed with yet? Do we know the underlying cause of their meningitis? No, so I can't give you a specific answer. So in general, we want to do contact precautions and droplet precautions, maybe even use an N95, especially if you think it's a TB or something that's causing it. As we mentioned, viral is the most common. It's usually caused by a non-polio enterovirus. Here's examples of them. What do most of these things have in common? They're all viruses. What else? Something really important. Something simple. You can be inoculated against most of them. Most of these have an inoculation. Most of these can be avoided. Enterococci VRE. So this is a resistant bacteria. So it's evolved, it's developed resistance to our antibiotics. It travels person to person or person to equipment. Normal presents in the human intestines. It's part of us. We have it in us. The problem is when it leaves where it's supposed to be. It's not the best picture. The one on the right is supposed to be, the bloodstream. The other one's a surgical site, and the other is bladder. So if they have to put a Foley catheter in you. You have a surgical procedure. If it manages to get into your bloodstream, into your body in those sites, it will cause an infection of those sites. So the symptoms will be different. If you had a urinary tract infection, how would you feel? Well, a lot of times you'll have like burning on urination, you might have some pelvic pain, you'll have a fever. If you have an infection in a site in your body, it gets red, it gets swollen. So the symptoms will change based on where the infection with the VRE occurred. People with immune systems that are weakened are obviously most at risk. Like we said, this is in the body normally. So, but if your immune system gets weakened, it can run rampant. Don't spread it. This is where we should be wearing gloves. This is where we should be doing the proper cleaning. You may have a perfect immune system. You may not have any open sources for it to get into your body. But if you touch someone that does, you could put them at risk. We don't want any of our loved ones or other people to get sick. It can survive on hard surfaces for 5 to 7 days and on hands for hours. So if you don't wash your hands correctly, you're taking it to the next call, you're taking it back to headquarters, you're rubbing it all over your steering wheel. These are things we don't want to do. So what are we going to do? Hand hygiene, gown and gloves are contact precautions. Thankfully, it's pretty easy to kill on the outside of the body. We can use our bleach, we can use our purple tops. C. diff. How many people have heard of C. diff? We see it a lot in nursing homes. All right? Guaranteed your town has had C. diff in it. All right? It's a bacteria. Goes person to person. It can survive up to 5 months on inanimate surfaces. So, symptoms. What do we know about it? Diarrhea, you get inflammation of the colon. Most people will tell you it's a particularly foul-smelling diarrhea. You kind of have a hint of it when you walk in the room. Something doesn't smell right. The other thing is, it's almost always in conjunction with use of antibiotics. Why? This is important because this will make you suspicious of it.
Killing bacteria in your stomach.
Yeah. So it kills the good bacteria in your stomach, and the C. diff runs rampant in your intestines. Right? So if you had a bronchitis and they gave you an antibiotic, should that be accompanied by diarrhea for days on end? No, that doesn't match. So when you have that patient who tells you they got diagnosed with bronchitis a few days ago, they've been taking antibiotics for like 3 days, and now they've got constant explosive, foul-smelling diarrhea. Think we might have C. diff issue? Very possible. So we're talking 3 or more watery stools a day, symptoms lasting more than 2 days, new fever, abdominal pain, and again, this is the vast majority of times, this is in conjunction with having recently been put on antibiotics. So they will try other things to get rid of the C. diff. If they can't kill it with medication, the end result is they have to cut it out again. So if you can avoid getting it, the better off you are. So what should we do is to protect ourselves? Contact precautions. Gloves, gown, hand hygiene, right? Soap and water. Alcohol won't work on this. Okay. Bleach. So the EPA actually has a list of things, they call it List K, specifically for C. diff that will kill so that you can properly clean your equipment, your vehicles, etc. You Google EPA List K, it's right there. So TB. One of the ones we generally have a little more education about. What do we know about TB? Okay, I hear respiratory. We don't know anything else about TB. It's contagious. What else? Person to person cough, so the droplets and stuff. What else? Generally in America, we don't do that. Generally. Anything else? Okay, so coughing up blood and stuff is a possible symptom. So TB is a bacteria. Transmits mainly by tiny droplets made by coughing, speaking. We always think of it as lungs, infecting the lungs. It can actually infect many other organs. Okay? So here's a video from the CDC about TB. I thought this one was particularly good.
Tuberculosis, also known as TB, is spread through the air from one person to another. When someone with pulmonary TB disease coughs, TB bacteria are expelled into the air in tiny water droplets. These droplets can remain floating in the air for several hours, making it possible for someone nearby to inhale them. Once a person has breathed in droplets that contain TB bacteria, they travel down the trachea and enter the lungs, where they collect in the alveolar sacs. Once in the alveolar sacs, the bacteria begin to multiply. The body's immune system starts working and macrophages begin to surround the bacteria. A granuloma is formed to keep the bacteria from spreading. The TB bacteria remain in the lungs, but the body is protected from disease by the granuloma. In 8 to 10 weeks, the person will most likely test positive for latent TB infection. The progression from latent TB infection to TB disease occurs when the granuloma break open and the TB bacteria multiply. Then the person becomes sick with TB disease and may be infectious. This progression can occur immediately after infection, many years later, or not at all. When the TB escapes from the granuloma and begins destroying a person's lungs, it's called pulmonary TB. TB bacteria can also enter the bloodstream and travel to other parts of the body, causing extrapulmonary TB.
So obviously on the right is lungs that have been infected by TB. It actually eats away at the tissue in the lung. The thing on the left is actually someone's tongue. And there were other far more graphic pictures of other organs and stuff infected, but as the video said, it gets in the bloodstream and it can affect many other organs. So symptoms, what do we usually think of as symptoms for TB? Coughing up blood. What else? Night sweats, difficulty breathing. You can get bizarre cases. We had one in a town in Bergen County. There are first responders here from that town, where the person just said, I have chest pain. No one really thought anything of it, but he had this weird cough. Like, let's just put a non-rebreather on him to be safe. He's got chest pain. Oxygen. 2 days later, my phone rings. It's the hospital saying, yeah, that patient, yeah, he had active TB. Thankfully, we had immediately put the oxygen on him, kept him from spreading droplets. No one came back positive for TB. So if someone is short of breath, make sure you put a non-rebreather on them, and if not, you can put a surgical mask. If you have like liver and kidney damage, you could. Just like you would with like a cancer patient or something like that. You're not processing toxins correctly when your liver or kidney are damaged. So that's when you'll see that jaundice color. But in general, if it's just in the lung, it usually will turn you yellow. So like we said, everybody gets a mask. So this is guidelines from the CDC for your workplace. tuberculosis.
Updated tuberculosis screening, testing, and treatment recommendations for healthcare personnel. On May 17, 2019, the Centers for Disease Control and Prevention and the National Tuberculosis Controllers Association updated recommendations for tuberculosis or TB screening, testing, and treatment for healthcare personnel in the United States.
These recommendations should be used for people who work or volunteer in healthcare settings, including inpatient and outpatient settings, laboratories, emergency medical services, medical settings in correctional facilities, home-based healthcare and outreach settings, long-term care facilities, and clinics and homeless shelters. CDC and the National TB Controllers Association recommend new hires receive a baseline individual TB risk assessment, symptom screening, and a TB test.
In the United States, there's no recommended annual testing for TB unless there is a known exposure or ongoing transmission at a healthcare facility. Healthcare personnel with a positive TB test result should receive a symptom evaluation and chest x-ray to rule out TB disease.
Treatment for latent TB infection is strongly encouraged. Shorter treatment regimens should be used as they are more convenient and more likely to be completed. Healthcare personnel with untreated latent TB infection should be screened annually for symptoms of TB disease.
Symptoms for TB disease include any of the following: a cough lasting longer than 3 weeks, unexplained weight loss, night sweats or a fever, and loss of appetite.
All healthcare personnel should receive TB education annually. TB education should include information on TB risk factors, the signs and symptoms of TB disease, and TB infection control policies and procedures.
State and local TB screening and testing regulations may differ based on local needs. The CDC and the National TB Controllers Association TB screening and testing recommendations do not override or replace state regulations. Contact your state TB control program for more information.
CDC has resources to assist facilities with TB screening for healthcare personnel. Visit www.cdc.gov/TB to learn more.
So that's actually a pretty big update for us. For years, they've been having healthcare workers get TB checks every single year, no matter what, and they kind of let you just walk around with latent TB all the time. Now they're telling you get that treated, and they're not doing the screening every year in most cases. So thankfully, it's pretty easy to kill it. We use our purple tops on any visibly soiled surfaces, high-touch surfaces, equipment. Nice thing is it doesn't survive well on fabrics and stuff, so it doesn't. That's why we only have to wear droplet precautions, airborne precautions are N95. So, on to the main event, what you've all been waiting for, coronavirus. So, what do we know about COVID-19? Okay, unfortunately, we're learning new things and things are changing. I've been updating this presentation on a nearly daily basis at points. So we need to stay up to date, be checking resources, new information is coming out all the time. What else do we know about it?
Coronavirus is a fairly common virus.
Okay, so yes, there is a whole family of coronaviruses. This is one particular type of coronavirus, all right? It is very infectious. It goes person to person, close contact droplet via droplets. It is zoonotic. It came from an animal, and it evolved to attack us as well. It's happened before. So the taxonomical name for this virus is SARS-CoV-2. Sound a little familiar? Yeah, it's not the first time we've seen those first 4 letters. We've dealt with a SARS virus before. This one is different though. So far, and this was as of yesterday, these are the countries that have had cases of coronavirus, as per the CDC. When we first ran this class about a month ago, there was nothing here, nothing here, nothing here, and there was a few more white spots over here. It's spreading pretty rapidly. So what happens? Similar to the flu, it gets into your lungs, the virus attacks the tissue in your lungs, your immune system responds, it starts destroying cells, things get inflamed, things get swollen, you develop pneumonias, and if it doesn't get under control, that's what can kill you. So, one of the things we keep hearing is, well, what about flu versus coronavirus? So, statistically, as per the World Health Organization, only about 0.1% of people die of flu. Statistics as of March 3rd, globally on coronavirus, is 3.4%. This is not Ebola level of death, but that's still significantly higher than flu. Now, yes, the death toll is lower right now because it hasn't spread as much as flu. But the statistics are that it will kill more people, which is why it's so important for us to take preventative measures. So, as of 4 o'clock yesterday, there's 423 people in the United States that have confirmed cases of coronavirus. 19 have died. Officially, as per the CDC, I've heard that there may be 2 more this morning. So the symptoms we're looking for: fever, cough, shortness of breath. Symptoms appear 2 to 14 days after exposure. Our big question is, have they been traveling? Have they been exposed to anyone with the virus? So, like other infectious materials, it can survive on surfaces. And the one thing that I was actually happy about as I was updating this slide got better than it used to be. Originally, they were saying like 9 to 10 days on surfaces. World Health Organization is now saying hours to several days. Hard surfaces like steel being particularly more prone to holding the virus. Softer materials, not so much. So the biggest and first step is dispatch. There is no reason that anyone in this room should be a blue canary, all right? You should not be the one that finds out this has happened. There is proper screening to avoid us getting exposed. So, the International Academy of Emergency Dispatchers has a guide card specifically for dealing with things like coronavirus, Ebola, etc. Absolutely, positively, without question, your dispatch center should be using something like this to screen and warn you before you walk into the house. If you go to the International Association of Emergency Dispatchers webpage, that is there. So normally, first responders, we kind of tend to be the lost, forgotten children. In this case, the CDC actually put out something specifically for us. And whether you're police, fire, or specifically work on an ambulance, you're EMS when you start treating people. All right? So there's the interim guidance for emergency medical services. I highly, highly recommend that you should all read it. It's not super long, but it will give you the guidance you need. We're going to talk about some of the highlights now. So, first things first, has there been travel? Have they been exposed to anyone known with the virus? Right? Obviously, the questions have evolved. Originally, it was just like, oh, have you traveled to China lately? Not so much anymore. It's in a lot of countries now. So have they traveled internationally? Have they come in contact with anyone? Our assessment. As much as we love, human contact and hey, how you doing? My name's Charles. Keep your distance. All right? When you first walk into the room, keep 6 feet of distance between you and the patient. If they tell you, oh, I broke my arm, they're not showing cough, cold, symptoms, okay, then we can do our normal thing. But if they have those symptoms, keep a 6-foot distance as you're asking questions. If they answer yes to these questions, you think that they might have coronavirus, guess what they get to wear? Mask. Now let's say they're a little short of breath, and I just want to put them on a nasal cannula. Can I do that? Yeah. Who said it? And put a mask over it. Very easy, okay? Just add the mask on top of it. If they're really short of breath and need a non-rebreather, you're good. Just put the non-rebreather on. You don't have to add a mask on top of that. So the recommended precautions as per the CDC is that we wear our contact precautions and airborne precautions. So we're wearing our N95, and they also want you to wear goggles or the big visor. They did recommend, if you're using a bag valve mask, that you equip HEPA filters. This is to try and help prevent the spread of the material. In most cases, that's not how our patients will be that bad in general, but that is recommended that we have those available if the patient does need artificial ventilation from us in the field. So one of the guidances, and the question came up, was, it says, if possible, the rear doors of the transport vehicle should be opened. Not as you're driving down Route 17. Okay? Every single person in this room has been on EMS scenes. If the patient is really sick, and we get the patient in the bus, are we necessarily ready to move right away? No, we may need to do some stuff to stabilize them right there. The doors of the ambulance, if at all possible, should be open so that we don't create a death chamber of virus, okay? So, but once we're moving, close the doors.
Bubble wrap. Bubble wrap.
So we talked about the dirty gloves in the front compartment. What do we think about PPE now that we're dealing with coronavirus in a vehicle? Blanks? Okay. So if you have an isolated driver's compartment, there is a door, window, whatever, it's shut, you're good, then you doff your PPE and just keep your mask on. If you have a non-isolated driver's compartment, so you can clearly get in between the box and the cab, you're going to red bag everything, you're going to wash your hands. Yeah, I totally screwed that up, I apologize. So if it's isolated, you doff everything. If it's non-isolated, you need to keep your mask on. I apologize about that. Pictures in front of me, I didn't even say it. So if it's an open box to cab, you need to wear your mask, but doff everything else and make sure you do hand hygiene. The alcohol hand gels do work. So now, we do worry then. Well, if the front is open, could virus be getting into the front? So what you're going to do, and it sounds a little counterintuitive initially, you're going to roll up the windows in the front of the truck. You're going to set the fan in the truck to bring air from the outside. And all of our ambulances have those vent fans. And we've always thought about those as like, that's how you get the stank out of the ambulance. All right, this is what they're actually truly designed for. You'll create negative pressure and be pulling the air out through the ambulance, so nothing should go up front. You're creating a negative pressure environment. Do not surprise a hospital with a possible coronavirus. All right? Just like no one in this room wants someone to walk in and go, yeah, my corona's flaring up today. How you doing? All right? No one wants that. All right? We've all been to emergency rooms. They're packed full of people, especially during flu season. All right? A lot of cases, most of the hospitals are going to have you pull up at the ER bay. Someone will meet you outside, or they'll give you directions and say, go through this door. Frequently, they're using like their hazmat decon room, not because they're going to decon, but because it's isolated. They'll put the patient through that way so that they can avoid putting the patient in contact with other people. So avoid putting anyone in the ambulance from a house that has infected people. If anyone, you are going to take anyone with you, they need to wear a mask. But avoid bringing people in the front seat. This picture amuses me just because, is he patient zero? The only guy not wearing a mask? All right. So like we said, people need to wear their masks. So cleaning recommendations. Air the truck out. Open things up, let it air out while you're giving a report, writing your chart, etc. You need to keep precautions on while you're cleaning. You're dealing with things that are infected. Clean the ambulance first, then doff for the person in the back. Thankfully, the purple tops work. The spray also works. There's lots of things. Coronavirus, thankfully, on the outside of the body is not the hardiest thing. It's fairly easy to kill. There's lots of things that will work on it. Again, make sure that you wait the appropriate amount of time so the chemical has time to take effect. You need to clean everything. Right? The stretcher, the rails, the control panel, the floors, wipe down. If they're hacking, they're all over. Remember we said, what distance do we want to keep? So we should probably clean anything that's within, is a lot of the surfaces in your ambulance within 6 feet? Yeah. Okay. And don't forget things like blood pressure cuffs, stethoscopes. The more disposable things you can use, the better off you are. I know we are looking to go to like disposable blood pressure cuffs and stuff so that we don't have to worry about that. There are ways to do remote telehealth. So this is becoming a bigger and bigger thing that you're starting to have some symptoms. You think you might have it. Okay? You've got like cough, cold symptoms, you've got a fever, right? Do you really want to be parading around a doctor's office? Should we really be walking around the hospital? Probably not a good idea. So there are things that we can do to avoid that. If you have minor symptoms, Hackensack has something called Convenient Care Now. That's the website. And you can actually speak to a doctor live time over the internet. We're not the only one with that resource. Newbridge has it as well. Phone number that you can call in, and they will do telehealth with you. Again, this is for minor symptoms. You think you might have it, and you can get screened. So, I said it again, but it warrants reiterating. I've given you information that's current as of today. It's evolving on a daily basis. You need to be reading, you need to stay up to date. Make sure you're checking the CDC, the World Health Organization. Stay current. You're talking about protecting yourself and your loved ones. So, know what you're up against. The minute you see signs, in a nursing home, we've got contact precautions, we've got drop-off precautions. We need to ask, what is the virus? If you have to, Google it. And I don't expect you to have all of this memorized, but protect yourself, ask questions, know what you're up against. Prevention is key. Wash your hands correctly. Use the hand gels correctly. Keep rubbing until it's dry. Make sure that you've been warned what PPE you should be wearing. Wear that PPE. Okay? And make sure that you decon correctly. Make sure that you are cleaning all of the surfaces with the proper types of chemicals.